Welcome to the Daily Brief on Metro Milwaukee's health and the economy. My name is Tim Sheehy, president of the MMAC, and I'm joined by my co-host, Dr. John Raymond, president of the Medical College of Wisconsin. Each day at 3:30, we deliver a 19-minute fact-filled update on the health and economic impact of COVID-19. The webcast is powered by Aurora WDC, and we're also joined by our newly re-elected mayor, Tom Barrett, who will join us in just a moment. But first, let's start with an update from Dr. Raymond.
Thanks, Tim. Let's go ahead and go straight to the scorecard. Over the last month, we've seen steady improvement in our two indicators of how we're flattening the COVID-19 curve, and the favorable trends continue today. There were 66 new COVID-19 positive tests in Milwaukee and 170 in Wisconsin. The daily growth rates continued to improve to 7.2% in Milwaukee and 7.6% in Wisconsin. And recall that in mid-March, the growth rate was nearly 35%. So this shows both improvement and stabilization of our progress. And if we only take the last 7 days into consideration, the average daily growth rates are about 4 days for Wisconsin and for Milwaukee. The doubling times also improved to 9.7 days in Milwaukee and 9.2 days in Wisconsin. Now, I'd like to remind our participants that the trend is more important than the actual numbers, and that trend remains positive, having improved over the last few weeks and stabilized over the last few days. Next slide, please. This slide shows the number of new COVID-19 positive cases in Wisconsin each day since March 12th. As you can see, there's been a leveling off and possibly the beginning of a decline, although there is a lot of day-to-day variability. Either way, this appears to be a positive sign. But I caution everyone that we still have a significant number of new cases every day. And because our hospitalization rate runs at about 30%, that 170 new cases translates into about 50 new hospitalizations in our state, assuming that the hospitalization rate holds steady. Next slide, please. This slide shows the trend for the doubling times in Wisconsin each day since March 18th. And as you can see, there's been a consistent improvement since the safer at home order went into effect on March 25th. Good job, everyone. Next slide, please. This slide shows key indicators of hospital capacity, and these capacities became available from the Wisconsin Hospital Association within the last week. As we've shown for the last few days, the first 3 rows show that we have an ample capacity of hospital beds, ICU beds, and ventilators in southeastern Wisconsin. And that trend carries throughout the entire state. Thus, we've not overwhelmed our health systems. Unfortunately, we do have many hospitals with a short supply of personal protective equipment, as shown in the last row. And I believe that this is a problem that will be with us for quite some time, even with the responsible reuse of N95 masks and switching from disposable gowns to washable gowns. If I could have the next slide, please. These are our 5 key indicators. You can see that our indicator for 2 weeks of declining cases remains yellow and that the testing capacity remains red. But I hope that this indicator can be upgraded soon. We've also upgraded the hospital capacity indicator to green, although I caution that none of our health systems has restarted elective procedures. PPE and public health tracking remain red, and those are the 2 indicators that I believe will be problematical for us going forward. Now, I've been thinking deeply about these indicators over the last few days, and there are 3 important aspects of the proposed indicators that I'd like to highlight. First, and probably foremost, I want everyone to understand these indicators are a set of tools. They're not hard and fast rules. Second, these indicators need to be refined. So what needs to be refined? First, we need to clarify what are the best metrics to use for each indicator, and those are evolving. We also need to decide who will be our source of data for each indicator. And again, those are evolving as data sets become available. And we really need to decide who has control of the score, the green, yellow, and red circles. Now, third, I want to emphasize that these indicators are not a comprehensive plan. In order to create a comprehensive plan, we'll need to consider economic and societal indicators as well. Now, I have some preliminary thoughts about what other components might be needed to create a comprehensive plan. One idea is that each business sector should have guidelines for providing a safe working environment. And I know that the MMAC is working hard to provide those guidelines. Another idea is that we should provide detailed guidance for public-facing businesses so that they can provide a safe environment for their workers and for consumers. Perhaps the idea of a business safety card has merit. And I know that there have been ongoing discussions and some good thinking around this issue. We also need a contingency plan for new surges that are not contained by standard public health methods. In other words, we need to be able to pull back in a measured and appropriate way if there's a new surge. And this should not be optional. It's a necessity for our accountability. And we also need to factor in economic considerations because those are real and acute. And finally, we need a communication plan that tells the public how we're doing and delivers clear and consistent messages about what we need from our citizens and what we need from the business community. So it's clear that we have challenging and important work to do in the weeks ahead to save lives and to save livelihoods. I'm supremely confident in all of you, the leaders of our business community, to work together to help our elected officials to make the best possible decisions. So I thank you, and I'll send it back to Tim.
Thank you, Dr. Raymond. One question before we kind of bring the mayor in here. It seems to me that at least a couple times a week, I will get an email from a reputable company that has a supply chain for PPE or masks. And so is your sense, if hospitals are going to use these now for the foreseeable future, my sense is the supply chain is going to ramp up to meet that. What's your sense?
I hope so, and I'd love to buy from Wisconsin. So let's get that supply chain ramped up.
Good comment. Well, Mayor, as I mentioned at the outcast, congratulations on your new term. Ended under challenging conditions. It's beginning under challenging conditions. So let me start out with an obvious question is, how are you reacting to the pronouncement yesterday that the Safer at Home has been extended to May 26th?
Well, I was not surprised that it had been extended, just as you're seeing it extended in other states, primarily through the Midwest. And now that we're in this group of 7 Midwestern states, I think that the governors, both Democratic and Republican, recognize that just as the Northeastern states are trying to work together and some Western states are trying to get to work together, in the Midwest, the governors have made a decision that they're going to try to coordinate because our economies are more tightly connected than other parts of the nation. So I wasn't surprised. My sense is that there's going to be continuing growing frustration, though, both from the businesses themselves and from the employees of the businesses. And that underscores why it's so important for us to do whatever we can right now to emerge from this. And I think one of the key challenges here is my sense, and we were talking about this a little before the show here, if you want to call it the show, was after the first order, there was a sense, well, we can make our way through this. And there was a thought that, well, maybe after a couple or 3 weeks, that there would be light at the end of the tunnel. The announcement that the final date now, or the end date, the projected end date is May 26th, I think caused a lot of businesses and individuals to be frustrated. And I certainly understand that frustration. And it's real. It's real because businesses are suffering. And all you have to do is look at the unemployment rate and the claims for unemployment, and you can understand why the temperatures are going to be rising. So I think having a plan to emerge from this and being able to provide hope for businesses and individuals is paramount. And one of the things that I was struck by listening to President Trump on Wednesday and listening to Governor Evers yesterday was, in many ways, as different as their political philosophies are, how they were more aligned than I thought they would be as to creating the roadmap that will allow us to emerge from that. And that roadmap looks a lot like that dashboard that was just presented by Dr. Raymond. And so when I'm talking to people, it's that dashboard that I put a lot of weight on, because I think that that is really the key. If we can focus on those indicators, and I'll just comment on a couple of them. When this started a month ago, I had several concerns. And right off the bat, I was very concerned by testing, because everything I've read has put a premium on testing. Second was, having the hospitals provide the information that we need to understand not only where we are right now, but where they think we will be. And I have been very impressed watching the hospitals and watching Dr. Raymond and others come together. And I think that is a place where, as was indicated there, we're making progress. I think that the information flow is really excellent right now. And I think that that is what has allowed us to have that green light in terms of hospital capacity, because now we know where we are in terms of beds, in terms of ICU beds, in terms of ventilators. I continue to believe that the alternative care facility at State Fair Park is an insurance policy. And just as you buy an insurance policy for your home that you hope you never use, I hope we never see a patient there, but I'm happy that it's there. So to me, one of the biggest challenges right now is expanding testing. And that includes community testing, because I think that's going to allow us then to identify individuals who are tested positive, isolate them, and then do the part that also has the red light, which is that contact tracing. And the contact tracing at first blush seems to be a big challenge, because it's literally detective work. It's human detective work. Okay, who are you in contact with? Who are you in contact with? And getting the people to do that. But when you look at the number of people out of work right now, I think that that's a marriage that can be consummated very, very quickly, and have some people joining us, and the state has been very helpful there. So again, I want this to be a hopeful conversation. I understand the frustration, but the last thing I think any of us wants to see is to have this thing come back with a vengeance sometime later in the fall. So long answer to your short question.
No, it's a good answer. And I think that we're all hoping that this dashboard and these indicators give us the information to kind of reel that date back in closer from May. Let me ask you about another challenging piece of news that came out yesterday, and that was the DNC Committee reducing its size. Does that cause you concern about A, the planning for the convention, and B, a potential signal about the convention here in Milwaukee?
I think it's very much a reflection on what has happened with the fundraising. And I think it's not just them. I've gotten phone calls from numerous not-for-profit organizations that are challenged right now, because a lot of the giving is down, and it's down dramatically. Charitable giving is down. Certainly we're seeing less money being spent in retail, places like that. But the political giving is down, at least on the Democratic side. I can't speak for the Republican side. So I think it was, as much as anything, a reflection on its books, and that they know that they have to manage those books. In terms of the convention itself, I still think it's too early to be seen. My hope remains that we will have a very vibrant convention, and that will be a shot in the arm for the restaurants, for the hotels here, and it will also be a signal to the nation on how a community emerges from this. That's Tom Barrett, the optimist. That's what I want to see happen. But I'm also realistic, and I don't know whether we're going to have people who want to travel in droves in August, no matter how good our weather is. I'm obviously hoping that we're at a place where the science will say that that's a good move and that people will want to come. But the Republican convention is just 1 week later. So I think that ultimately these are probably going to end up going somewhat in tandem in terms of what they're going to look like. But the last thing I'll say on this is two things I know for certain. One, the Democrats are going to nominate a candidate for president. And two, that's going to happen in Milwaukee.
You could probably say three and name the candidate.
I could do that. I was going to do that. Then I thought, well, then I would have used two before I said it was going to happen in Milwaukee.
So let me ask you one other question, and we'll bring Dr. Raymond back in and get some questions from the audience. You made an interesting observation about the number of cases here in Milwaukee County versus Minnesota, and you want to share that. And then two, last week we were on, you were concerned about some hot spots in the city. How's that progressed?
Well, I'll talk about the first one first, because it's really interesting seeing the Midwestern states. We have approximately, I can give you the exact numbers from just 10 minutes ago. In Milwaukee County, we have 2,055 positives and 111 deaths. In the entire state of Minnesota, they have 2,071. So they have 16 more cases in the entire state of Minnesota than we have in Milwaukee County. And the number of deaths they have is identical to Wisconsin. They have 111 deaths in all of the state of Minnesota as we have in Milwaukee County. So that's the bad news, that Minnesota is just it is thumping. It is killing it. But if you look at the other Midwestern states, our per capita incidence is 69. That is the second lowest in the Midwest. Behind, way ahead is Michigan, then Illinois, then Indiana, then Ohio, then Iowa, then Wisconsin. So I think that our stay at home, our aggressive moves have put us near the front of the pack, but Minnesota clearly has gotten ahead of everybody. They're number one in the country in having the lowest per capita rate for COVID-19, which is very interesting.
It is. Dr. Raymond, if you want to join us, Chris, we'll go to questions from the viewers.
For sure. We had a lot of questions about testing, as you might suspect. Updates on the latest progress that have been made, either nationally or in our state, and how that interfaces with trying to reopen the economy.
Yeah, I'm becoming more optimistic that we'll have not only enough testing that we can start moving into the community with the test for virus, which is the viral RNA or PCR test, but also there's a lot of promise that we're going to be able to have some real capacity for serological testing. And in the ideal situation, we'd be able to do both of those together. I just had a conversation yesterday with Mayor Barrett about how excited we are if that capacity could come online.
We also had a question about the value of the Midwestern states working together, and would they necessarily have to agree on the same date to reopen, or is that maybe not a provision of that collaboration?
I don't think they have to be on the same date. Go ahead, Mayor Barrett.
I think I totally agree. I think the goal is to work in tandem, but there's nothing that binds them.
Another interesting question about whether grocery workers should formally be designated as first responders and whether that would help them get access to PPE.
I'm not sure I would designate them first responders, but I would designate them as high frequency, high contact human interaction, and that they should get special consideration, just like people that are driving our buses and Ubers and things like that, where it's difficult to maintain that social distancing, and they should get, in my opinion, some personal protective equipment.
I would agree.
Mayor Barrett, we had a question about some potential cases in the Milwaukee Police Department, either of people testing positive or in quarantine, and whether that affects the ability to service the population.
Well, one of the things that we were just looking at the information we have today, because obviously as this moves forward, this began as very much a public health crisis, and it still is a public health crisis. Right along with it is why we're all here today. It's an economic crisis, and you see that in the pressures that are on businesses and on the claims for unemployment. The third wave of this, unfortunately, is the wave that's going to hit local and state businesses. I mean, local and state governments, in addition to what it's doing to the national deficit and national debt. But at the state and local level, we are taking a massive hit because of our loss of revenue and our increased costs. Now, one place where we might be able to control some of those costs is in the police department, because there are not a lot of public events and there are no court appearances right now. And those are two places where we have generated a lot of overtime historically, is in public events and court appearances. And right now that none of those exist. So that has actually helped our overtime numbers, but it also means that those individuals can step in to the extent that we've got people who are quarantined. And I know both the police department and fire department have had situations where people have had to be quarantined. And we've talked about that in terms of, it's a 14-day quarantine. Is there something we can do? And the decision, at least up to this point, is that's still the most prudent way to deal with people who have been exposed in a very serious way.
Great, thank you. And thank you to everybody who asked a question today.
Good. And again, Mayor Barrett, congratulations on your reelection. Dr. Raymond, congratulations on Dr. Raymond, thank you for, again, your service. And you might as well take credit for a good week of healthcare news. So have a good, safe, healthy weekend, everyone. And we'll see you Monday at 3:30 for the next broadcast. Thank you.
Thanks, Tim. Thanks, Mayor Barrett.
Thank you both.